The cases in the dorms have climbed exponentially due to the high density of people living in close proximity and sharing living and sleeping spaces. Now, these factors are similar to other weak links in Singapore's battle against the virus, like nursing homes, childcare centres, and preschools. But now let's take a closer look at the dorms, which are seeing a rapidly rising number of people with the virus. Joining us for this discussion are Mr. Alex Au and Dr. Leong Hoe Nam. Alex is the Vice President of an advocacy group for migrant workers, TWC2, which stands for Transient Workers Count Too. And Dr. Leong is an infectious diseases physician from the Rophi Clinic at Mount Elizabeth Novena. So, Alex, let's start with you. The Ministry of Manpower has stepped up measures to contain the spread of the virus at the dorms. For instance, moving about 7,000 foreign workers into alternative living areas like military camps, floating hotels, and vacant HDB blocks, and social distancing measures to minimize workers' interaction, which include providing meals to avoid communal cooking. Medical support is also on hand. Are the current measures helping, you think, and what more can be done?
Current measures may not be adequate, as you can obviously see from the fact that infections are climbing very rapidly. And I think we really need to look closely at what exactly those measures entail. There's a lot of talk about social distancing in the dormitories, but mostly focused on the common areas on the ground floor, in the dining room, and so forth. And at the same time, there are these strict rules about workers having to stay in their rooms itself, right? So what that means is that your social distancing rules apply to maybe 2 hours of a day when they are able to mingle in the common areas or move around. But for 22 hours of the day, they all have to be in their rooms, and they're going to be in close proximity with maybe 10 other, 12 other, or 20 other people in close proximity every day for 20 to 22 hours a day. So I'm not sure why we still think that these rules represent social distancing. There's going to be, obviously going to be some transmission going on when you're in the same room with 20 other people, and we're talking a pretty small room here. So we should be very careful about transposing middle-class assumptions from Singapore-type families living in HDB flats where you are one or two persons in a bedroom into a dormitory situation. And, so we have been arguing that, you really have to move people out because the dormitories themselves, the rooms, are not really safe spaces anymore. We think of home as safe. But when your home is on fire, you don't tell people stay at home. You tell people get out. So we have to think in terms of moving lots of workers out in order to reduce the density. Now, you've mentioned a figure of 7,000. Yes, I heard that figure too 2 days ago. And frankly, when we know that there are 300,000 workers staying in various dormitories of various kinds, 7,000 is 2%. It doesn't make much difference in the density at all. So I don't think that this is going to be sufficient. And when they move them out, are they tested before they move them out? If not, things can get worse. We don't know the answer to that question.
Right. Well, Dr. Leong, let's bring you into the conversation. What are your thoughts on the current measures?
Now, the current measures can be improved further. I'm going to discuss it in terms of the medical side of it. Like Alex, I agree with him that if we try to put all of them inside a dormitory again, we still have transmissions to 10 to 12 people. And ideally, you want a room which is just only 1 to 3 others so that the risk of transmission further will be cut down. But if you think about it, with 200,000 workers out in the dormitory, to actually find accommodations for them overnight or just even within 3 to 4 weeks, it is a big, big, tall order. I can't even possibly imagine how this can be done. The second thing which I would like to see, if it's possible from the medical perspective, is to actually screen workers now, even though if they may be asymptomatic, have no fever, have no cough. Now, we know for a fact that there are many people who are asymptomatic and they may pass infections, and in turn, they may spread the infection further when they go to common areas. Number two, we have heard stories of migrant workers who are not reporting sick even though they're unwell because they don't want to be taken out of the dormitory, put into the hospital, put into some form of quarantine because it will be a withdrawal of their privileges. I can empathize with them, but they must also see the bigger picture of preventing the spread within the dormitory as well as within the whole Singapore. So there's a greater good, there's a greater sense of work which we need to do, which is for the whole Singapore. Now, which means that in effect, we would have to screen each and every one of the help of the dormitory of the foreign workers there are. We may have to do an entry as well as do an exit PCR, which means 200,000 times 2, 400,000 PCR. That's a major tall order, huge amount of resources to implement it. And mind you, we are a small country which is fighting for all these reagents amongst the big players, including Germany, USA, and Korea. Will our requests for reagents get fulfilled? That's another issue. So not only do we have our own desires, as well as the needs of the individuals, the needs of the foreign workers as a whole, but as well as what we can actually provide realistically on the ground. Big tall order, Ministry of Health and Ministry of Manpower.
Well, both you gentlemen mentioned moving the workers out of the dormitories. 19 of the 43 purpose-built dorms are active clusters. 12 dorms are now gazetted as isolation areas, and workers there have to be quarantined for 14 days. So there are calls to find alternative accommodations for the workers. But Dr. Leong, let's go to you first. What is realistic and feasible to achieve this?
I think it's really, really difficult. Think about trying to get accommodations for 200,000 people. You need about 2 or 3 per person, 2 or 3 per room. So that works out to be at least 70 to 80,000 rooms all of a sudden. I think it's very difficult. And even if you can, you are going to go to a room which is not purpose-built for that, and you don't have your own comfort measures. And mind you, they will have to remain locked up inside the room totally. I think it's really challenging. So going forwards, if we were to think about it, when they actually finish, when the whole COVID-19 finishes, then do we actually need to think about these accommodations, future accommodations? Will there be enclaves and build-up of foreign workers in certain regions? And this will create a massive dormitory-like effect for the whole group as such. And in fact, we are moving the whole dormitory effect to a HDB estate or another estate. So we're back to square one. Mind you, they also have their own cultural needs. They want to partake meals together. They want to do things together. And when you actually do that, you allow the virus to spread. Can we get the information across? The need to social distance, the need to stay away. Come on, they are human beings. They need contact. They need emotional support as well. So it is really a big tall order, and I'm not even sure if I'm the right person to answer this.
Well, Alex, would you like to weigh in? How feasible is it to actually move these workers to alternative accommodations?
I don't think we have exhausted all possibilities. We have suggested, for example, using all the available car parks in Singapore. If you imagine, we must have thousands and thousands of car park lots in all sorts of multi-story car parks, especially in shopping centers, which are largely deserted nowadays. We could very well commandeer all of these car parks, including the massive car parks at the airport. And we have the whole Terminal 2 at Changi shut down totally, which means we have huge holding rooms, which are designed very securely. If we really made an effort and used all these resources, I think we can move tens of thousands out, because I'm sure there are thousands and thousands, more than tens of thousands of car parks in Singapore which are underutilized right now. It's an enormous logistical effort, which is why TWC2, realizing that, called for very early planning and very early action to get these places ready. It's a bit of a pity that we're sort of like, I think, taking half measures at this point. As far as Dr. Leong's point about the need to be social and all that, that's true of Singaporeans as it is of other communities. But I also noticed from our work with migrant workers that they are just as understanding of the virus danger at this time. And in our operations, when we work with migrant workers and we ask them, you queue up nicely and you don't crowd around and you talk at a distance with each other, they understand and they abide by the same standards. So during this time, they understand, and I think we can trust that they too will be as equally responsible as Singaporeans. Obviously, after the COVID crisis is over, Singaporeans will socialize again, and they will want to socialize again. They'll want to have their film shows and their dances and the club nights. Well, we'll see whether the world changes totally after that, but they're no different from Singaporeans.
Dr. Leong, back to you. Now, yesterday we had a professor from the Sosui Hawk School of Public Health on the show, and he said it's reasonable to expect the number of DOM infections to hit 10,000 to 20,000 by the end of April. So if indeed the number of cases from the DOMs reaches 5 digits, can our healthcare system cope, you think?
Yes, I think it can still cope for a few reasons. Number one, the 10 to 20,000 figures, honestly, is actually very realistic. But the good thing is many of them, the bulk of them, are actually in good health. And their age is actually good. Again, they are much younger than me, which means the chances of them requiring intensive care or added special care will be very, very slim. So it will be unlike the proportion which we see in nursing home who fall sick, or even the SAFRA Jurong, those people who fall sick. They are talking about different age group and hence better outcome. With a different age group, then their demands on medical care will be much lesser. In fact, they can be nursed in expo with no minimal or no supervision at all. Now, what it effectively means is the real medical care will be concentrated to a small number of people, perhaps just 1 to 10% of them, and we can actually cope with them. How else can we cope? How else can the hospitals do? Elective surgeries have to cut down. And this is a part where Singaporeans have to understand where to give us some of the luxuries which we are used to. See a doctor for a knee replacement and have it scheduled the next day. No, this doesn't work. We have to give up some of this for our foreign workers who have actually worked so hard for us. Number three, even private hospitals can take up the added job. They can take on the patients who are relatively sicker and look after them in the private hospitals. After all, we are talking about more vacancies now with the lack of foreign patients coming into Singapore. Now, if Singapore thinks broadly, not just in government hospitals, but the whole Singapore and all the resources of healthcare system is placed under the care of the Ministry of Health, in inverted commas, placed under the care, then together we can actually overcome COVID and our system will not be strained.
Right. Well, Dr. Leong, you mentioned that the majority of these foreign workers are generally in good health. So does it mean you expect the majority of them, now there are more than 2,600 infected foreign workers. So do you expect the majority of them to fight off the virus?
Yes, I expect most, if not all, to fight off the virus. Okay, they have something which you have, which is youth. As for myself, I could end up on the poorer end of the spectrum, but they are going to do good. They are going to fight it off with little or no reactions. And in fact, they will have immunity thereafter. And this will come in handy in future outbreaks. So should they fall sick, I think they will do reasonably well. And they will be cared for in Singapore with good top-class medical care.
That is a very optimistic note. Alex, could you share with us what you have been hearing from workers affected by the recent safe distancing measures and how your organization, TWC2, is helping them?
Well, I just want to add one quick point to what Dr. Leong has been saying about their general health. It is true that foreign workers are of a younger demographic compared to me, for example. But right now, they are under such severe stress. And for years, there's always been a nutrition problem with foreign workers. They've been getting rather bad diets. And we're just wondering, I mean, I'm no doctor, but we're just wondering to what extent does that affect their immunity, especially now that they're under even more stress with worries about salary and confinement, and maybe they may not get along with their roommates and things like that. But anyway, so let's move on. What are they feeling there? The sense we get, and we're talking to a lot of workers who are able to reach us through the phone and through WhatsApp, the sense we get is that they are feeling rather trapped. All right, they're feeling rather abandoned. Now, that's a feeling that's natural when you're kept in a room for 22 hours a day. They also report that it's not easy for them to reach out to us. Despite what the Ministry of Manpower wishes, many dormitories still do not have Wi-Fi. At least the bandwidth, for example, is not enough to cope with so many workers wanting to be online. So there are these problems of connectivity, or they can't get the entertainment on their phones. There's nothing to do. It's very boring. And then, of course, they just feel trapped. And there was one worker who basically said, what are we doing here? We're just waiting for the virus to come and take us. And that's the kind of attitude that I think doesn't do very much for mental health. Then there are other workers who we've been helping before, but even now, like they've been injured at worksite accidents, and they need continuing care. Like we have some workers who need continuing supply prescriptions of painkillers. And the system has basically become very defective now because they can't go out to their follow-up appointments in the hospitals. They're in a quarantined dorm, but their prescriptions are running out. They have no more painkillers, so pain is going to come back again. What do? There is no clinic in the dormitory, and they can't reach out to anybody except maybe to us. And we try our best to reach out to other NGOs and see who can deliver a bit of painkiller to the poor guy. And of course, they worry about their salary. So they have all these worries. Many of them have not received their salary for the month of March. And they worry, going forward, will they have work? If they don't have work, will the employer have cash flow? If the employer doesn't have cash flow, will they get salary? So all these things just pile on. They are under severe stress and they feel quite abandoned.
Well, you have left us a lot of food for thought. We've been speaking to Alex Au, Vice President of Advocacy Group TWC2, as well as Dr. Leong Hoe Nam from the Rophi Clinic. Gentlemen, thank you so much for your time.